everyone. Welcome to our Monday Minute. Today we have some very disappointing news to discuss. As we feared, the proposed rule for 2025 rate adjustments for home health has been published and does include yet another cut to our permanent base rates. As began back in 2020 with the implementation of the PDGM model, CMS has continued to implement a very flawed budget neutrality adjustment included in the calculations of our rate reductions, and in 2025 are proposing a just over 4% decrease in the permanent rates. This is being slightly offset by a 2.5% increase in the market basket with a productivity reduction, so an overall 2.5% reduction, netting to a change of our permanent 30-day payment rate from $2,038.13 down to $2,008.12. This reduction would cause over a $280 million reduction in home health payments in the year 2025. Senators Stabenow and Collins have continued to fight the fight for home health. They have recently issued legislation, Bill S. 2137, to eliminate these rate cuts. As always, we need you to act on behalf of your organization and home health in general, to encourage your representatives to sign off on this legislation and help stop the madness of CMS continuing to cut at the home health rates, and eventually there be no home health care in existence if they continue to make the rate cuts that they continue to enforce. In addition to the base rate cut, they have increased the LUPA rates, as always, based on the increase in the inflation, the market basket minus the productivity measure. So the per visit LUPA rates have been increased by that net 2.5%. They have also added a LUPA add-on factor specific to occupational therapy that will be implemented January 1st of 2025. They have been using the physical therapy one for the past 2 years. They have made some detailed requests for information in this proposed rule that you really need to pay attention to. With the Home Health Quality Reporting Program, they have requested information on some additional social determinants of health information and other measures that they might be proposing for future implementation, none that would be implemented in 2025. For the home health value-based purchasing model, all of the 2025 changes were finalized in the 2024 rule. In this 2025 proposed rule, they are requesting information for some additional value-based purchasing measures to possibly be implemented in 2027, but at this point, it is a request for information only. They are discussing adding an additional condition of participation that would focus around the decisions being made to accept referrals and the policies surrounding that. They are also requesting information from your organizations regarding specific factors in your decision making of taking patients, how patients are suffering from access to care problems, etc., which these rate changes have definitely caused. And if any situation in your own agency's area has caused patients to suffer from access to care, we definitely need you to submit that information. Rehab Therapy, they are in discussion and requesting information surrounding how we feel about allowing registered therapists to conduct a start of care assessment in home health, even when skilled nursing is ordered. It has been a long-standing rule since the implementation of OASIS that even if therapy and nursing both were ordered, that nursing had to do the start of care. This request for information is to evaluate whether or not they should allow therapists to be able to do that start of care, even if nursing is included. They also mentioned that the disposable negative pressure wound therapy rates and the IVIG rates will be published in the final rule. And they are also proposing to change the definition of a new provider or supplier to include any provider that has had a deactivated Medicare number and goes through the process of reactivating that number. They would be included as a new provider and be subject to any additional scrutiny or reviews that would come along with being a new provider. As you have heard, this rule is detailed. The proposed version is over 250 pages. We will provide the link to that proposal. We will provide the link to the legislative information that we request you help us encourage your representatives to sign off on. We will also be doing a free webinar on this information at the end of July, and very shortly after the release of this proposed rule, the National Association for Home Care and Hospice will be providing you a nationwide webinar to cover the content. Thank you, as always, for joining and listening today. We must continue to fight against the cuts that CMS continues to impose on home health so we can continue, as always, to take care of patients in their desperate time of need. If HPS can ever assist you in any way, please don't hesitate to reach out. Have a great week.